There's a fear factor for this procedure. I think a lot of it's lack of understanding or awareness of what we're actually doing and what has changed in terms of technology. So the biggest fear is you're going to cause inflammation, cause a retinal detachment. And I think that's the biggest fear because you're firing energy into the vitreous, and so the thought is you're going to cause changes that will cause a retinal detachment or tear. There's no inflammation that we induce from this procedure, which is why we don't give any anti-inflammatory drops afterwards as well. And if you think about it, one of the biggest concerns that people have is historical studies on people who had YAG capsulotomies. We actually presented some data last year at the American Academy of Ophthalmology, and we did a retrospective study where we presented over 1,200 cases, 600 plus patients, some of which had 4-year follow-up, and we found 0 retinal detachments. It does not mean it cannot happen, of course, retinal detachments can happen in general, but we did not see in that study any detachment. There is a slight increased risk of a detachment in some studies. So the assumption is, if that causes increased risk potentially, doesn't this automatically cause an even higher risk? But I always challenge doctors to say it's a different mechanism and a different anatomy. In a vitreal lysis or a floater treatment laser, we're breaking up what we call collagen fibers. It's not the same connection to the vitreous base. It's a collagen fibers attached to each other in a matrix. So you're locally breaking that matrix up, but there's not the same transfer of energy to the periphery. So my pushback to doctors is yes, there's always a risk with any procedure, but we're not seeing that same retinal detachment risk that people are fearful of based upon the studies that we have published and then presented recently as well. The second thing is, aren't you going to cause 1,000 floaters? You're just breaking things up. And there's a combination of both. There is plasma. So with high enough energy, we cause a plasma reaction. So when we use this laser, there's a small area of plasma, which is 10,000 degrees Fahrenheit in a very small, few microns. What that means is there's a vaporization, but it's occurring in a small area. That's why it takes a number of shots to break these up and vaporize them. So we do a combination of both. We're breaking these clouds up, but then we go for those smaller pieces and try to vaporize those smaller pieces. And so that's the reason why we tell doctors, yes, it is breaking up, you're absolutely right, but there is vaporization as well.